course, that's following a period of really devastating spread in that state. But the more northern states continue to have a good deal of activity, as does the Mountain West and the West Coast. This pattern is interesting, especially when you look at it in a more global context. The next slide shows the world map. And in this one, we're not seeing the fine gradation within the U.S., but it's easy to see that most of the countries that are experiencing serious outbreaks right now are in the northern hemisphere. And I think that's led many to propose that some of the stabilization and increases in rates we're seeing are the seasonal virus, respiratory virus effect. So this pattern looking more like one we would expect with influenza. We don't know that for sure, and time will tell, but I think for right now, we're looking at a period that's likely to be stable to slightly increasing rates in the coming weeks. Locally, we've seen the same phenomena. This is the overall epidemic curve for the St. Louis region. It's a little bit hard to make out, but at the very far right end of the graph, the numbers have gone up from a low of in the upper 400s to the most recent rolling 7-day average of 542. So case rates, again, up a bit. And that is really broadly, many counties have experienced slight increases in rates. Our percent change in reported new cases, this is the 14-day rolling average, looking at it week over week. And unfortunately, we are in positive territory for the first time in a while, up almost 6%. And for those of you who follow the reproduction number, just a reminder, when it's below 1, the number of cases in the region is contracting. When it gets above 1, we see the number of cases expanding as the disease is transmitted more broadly. Right now we're at 1.1, which is the highest we've been for some time, and we'll have to keep an eye on that. Similarly, the new COVID hospital admissions, after a pretty steady decline from our peak in the low 80s, has now leveled off in the mid 30s, and we're seeing that result in a pretty stable pattern in the number of people who are currently hospitalized. It's not quite as obvious here, but in the low 200s, and that's been something that we've seen for several weeks now running. Currently, there are 241 cases in hospitals that belong to one of the 4 task force systems, with 62 in ICU and 41 on ventilators. Again, this is a pretty steady number. Last week, we had 189 monoclonal antibody infusions. Again, this number is up a bit, and we're actually happy to see that, because the more infusions we can give for newly infected people, the fewer of them are likely to be hospitalized. Death rates, again, have trended down. Our 7-day moving average is just below 5. And whether that's going to continue down or will also level off, as we mentioned earlier, we'll have to see what happens over the coming weeks. Currently, just about 3/4 of our hospitalized cases are unvaccinated. This shows that as of November 9th, 27% of cases in 3 of the 4 task force hospital systems are vaccinated. And again, most of the vaccinated patients who land in the hospital have other medical conditions that compromise their response to the virus. And again, we're down to single digits in terms of the number of pediatric patients currently hospitalized, which is very good news, only 2 in ICU. And we expect those numbers can come down further as people start to get their kids vaccinated. Discharges yesterday, 19, getting us very close to the cumulative 30,000 patient mark. That's probably not too many days off in the future. Forecasting ahead, again, we are following fairly closely to the most recent models that were developed. We had accelerated a little bit past that middle blue line, which is the mathematical best guess about where we're going to be. But right now we're adhering fairly close to it. We may have to reset that if this plateau persists. And the next slide shows a similar phenomena for ICU. again, staying fairly close to the model with perhaps a hint of leveling out at the tail end of that. Vaccination rates continue to rise very slowly. In St. Louis, we're, for the metropolitan area, we're up in the 52 to 53% range for fully vaccinated, and in the upper 50s for people who've had at least one dose. That's still a good 10 points behind what we've seen nationally. And again, that's really the best way we can buffer these ups and downs we're undoubtedly going to see with coronavirus going forward. Once again, this graphic will show you the case rates by individual county. As we've seen before, St. Louis and St. Charles County are the ones with the highest vaccination rates on the Missouri side of the river, with St. Clair and Madison the highest rates on the Metro East area. That brings us to the questions for today. So first is the question of whether there are plans to expand availability of boosters to the entire adult population. The various categories that are eligible for boosters right now under CDC guidelines is really fairly inclusive, so many people can get boosters. The FDA has already given its opinion that they think that it's likely to be fine for others to get boosters, although that hasn't appeared as a formal recommendation yet. So beyond that, we don't really know of any formal timeline. We do know that Pfizer has asked for approval to endorse boosters for everyone, but there's no new information about that right now. The second question concerns the new antiviral drug that Pfizer has submitted information for. Those early reports say it's 90% effective in preventing progression of infection. Those are unpublished data, so we have not really had a chance to review the actual studies themselves. If those numbers hold up, this will become an important part of the armamentarium for combating COVID. Again, I'll remind everyone that treatments for COVID are really very much needed, particularly ones that are more convenient than monoclonal antibody infusions. But they don't prevent people from getting sick and spreading the disease. So they're really for treating individuals who have come down with COVID and trying to prevent their progression. They really shouldn't be considered a substitute for vaccination, which can, in many cases, prevent infection. Third question is there a connection between breakthrough cases in any one of the three vaccines? There have been no head-to-head comparisons to look at breakthrough case rates. Some of the comparisons that have been done suggest that Moderna might be a little bit less likely to have breakthrough infections, and that Johnson & Johnson might be a little bit more likely to have breakthrough when compared to Pfizer. But those are really not data from head-to-head comparisons, which is what you would really need to be able to make a judgment about that. The fourth question is, has the FDA approval of mixing and matching boosters impacted breakthrough cases? It's really too soon to tell about that. The mixing and matching was just recently announced, although there was some small amounts of that going on before. We're going to need some weeks and months really to tease out whether mixing and matching has made a difference. We do recommend that for anyone who had a Johnson & Johnson initial vaccine, that an mRNA vaccine, that is either Pfizer or Moderna, is probably the best choice for a booster dose, but that information is pretty limited. The fifth question regards whether there's been a change in overall vaccination rates, and that is in the use of vaccines in general. For example, what's happening with flu shots. There's no question that during the height of the COVID pandemic, there was really a fall off in immunizations for childhood diseases. So these are vaccine preventable diseases that we really have come to think of as being more or less conquered by herd immunity and vaccinations. There is also some sense among clinicians that vaccine hesitancy is spilling over to other vaccines, including flu shots. I think that would be a really unfortunate consequence of the pandemic if we see a reemergence of vaccine preventable diseases. Many people just haven't lived long enough to have been around when these diseases rippled through the population, causing a lot of morbidity and some deaths. So we are strongly advocating that people stay on the flu shot bandwagon and get their flu shots as soon as possible. There are more cases being seen this year than last, and I think there's still time, however, for people to get vaccinated. Does the recent upturn in numbers reflect a temporary setback or predict a larger problem? Well, it's all conjecture at this point, but I think there's a strong suggestion from the maps I showed you and from the pattern we're seeing that this upturn represents the continued evolution of COVID into an endemic virus that's probably going to have periodic surges. It may well be one of the winter respiratory viruses that we've come to expect, whether it's influenza or rhinoviruses or other coronaviruses. That would be probably a best case, that it just becomes one of those that is here for a few months in the winter and then goes away for the rest of the year. But it's really too early to predict what the long-term pattern will be. I do believe, based on what we're currently seeing, that we're probably going to have continued disease transmission at fairly significant levels through the holiday season. And finally, the question about how have the first pediatric vaccines gone and whether there are supply issues. So far, pediatric vaccinations are going very well. There have been no particular problems. People are getting their kids vaccinated just about as fast as doses arrive in the community, but all vaccination sites have received all the vaccine they've asked for. Appointments are booking up, so I beg forbearance from people, have some patience. It'll take a little while to get everyone who wants a dose of vaccine vaccinated, but there should be ample supply. We have no suggestion on the horizon that there won't be plenty of vaccinations for people who want them. You can, in the meantime, if you are looking for a place to have your child vaccinated, look to Vaccinate STL or to the state's vaccination website, which give ample information about health system and health department-based vaccination sites, as well as commercial pharmacies that have vaccination capability for kids. So I don't think anyone should worry about getting a vaccination for their child, but it may take a few weeks to work our way through the number of people who are asking for it. So that concludes the overall briefing for today. Thank you for tuning in, and we'll look forward to talking to you next time.